Assalamu alaikum dear students. Today we will discuss Haematology MCQs part 1A. The common screening test for coagulation disorder is this: option A PT and APTT, B D-dimer, C fibrinogen assay, and option D thrombin time. So the correct option is A PT and APTT. Prolonged APTT with normal PT suggests a deficiency in option A factor 8, factor 9 or factor 11. Option B factor 7, option C factor 2, and option D factor 13. So the correct option is option A. Subscribe now and press the bell icon. Never miss an update from early technologist. Which vitamin is required to synthesize clotting factors? Factor 2, factor 7, factor 9 and 10. Option A vitamin K, option B vitamin B12, option C vitamin C, and option D vitamin D. So the correct option is option A, which is vitamin K. A left shift in WBC differential indicates an increase in option A band neutrophils, B segmented neutrophils, option C lymphocytes, and option D basophils. So the correct option is A band neutrophils. Which test is used to monitor heparin therapy? Option A PT, B APTT, C bleeding time, and option D D-dimer. So the correct option is B APTT. Cystocytes, fragmented RBCs, are seen in option A thalassemia, B microangiopathic hemolytic anemia, option C iron deficiency, D spherocytosis. So the correct option is B microangiopathic hemolytic anemia. Which coagulation factor is deficient in hemophilia A? Option A factor 8, option B factor 9, option C factor 7, and option D factor 10. So the correct option is A factor 8. What is the most common screening test for coagulation disorders? Option A prothrombin time and activated partial thromboplastin time, B D-dimer, C fibrinogen assay. So the correct option is A PT and APTT. DIC disseminated intravascular coagulation is characterized by option A low platelets, high D-dimer, prolonged PT and APTT, option B high fibrinogen, C normal bleeding time, and option D elevated factor 8. So the correct option is A low platelets, high D-dimer, prolonged PT and APTT. What is the anticoagulant used in APTT testing? Option A EDTA, B sodium citrate, C heparin, and option D oxalate. So the correct option is B sodium citrate. Which condition is associated with prolonged bleeding time but normal PT and APTT? Option A VWD, von Willebrand disease, option B hemophilia A, option C liver disease, and option D DIC disseminated intravascular coagulation. So the correct option is A von Willebrand disease. Which vitamin is required for to synthesize clotting factor 2, 7, 9 and 10? So option A, vitamin K, B, vitamin B12, C, vitamin C, and option D, vitamin D. So the correct option is A, vitamin K. Aplastic anemia is characterized by option A, pancytopenia and hypocellular bone marrow. Option B, elevated reticulocyte count. C, microcytic RBCs, and option D, spherocytes. So correct option is A, pancytopenia and hypocellular bone marrow. Which test is used to monitor heparin therapy? Option A, PT, B, APTT, C, bleeding time, and option D, D-dimer. So the correct option is B, APTT. What is the most common cause of thrombocytopenia in hospitalized patient? Option A, heparin-induced thrombocytopenia, B, ITP, C, TTP, and option D, DIC. So the correct option is A, heparin-induced thrombocytopenia. Thank you for watching my videos.